Treatment for a patient with a blowout fracture can include all the following recommendations except which one? A. Application of cold compress to reduce swelling. B. Appropriate oral antibiotic. C. Discouraging nose blowing to avoid creating or exacerbating any orbital emphysema. D. Use of decongestants to help keep the sinuses clear of any draining fluid. E. Use of steroid eye drops to help decrease any inflammation in the affected eye. Answer is A. Application of cold compress to reduce swelling. The use of steroid eye drops should not be initiated by the emergency clinician for a blowout fracture. Antibiotic prophylaxis against the potential sequelae of sinusitis, orbital cellulitis, and other more malignant intracranial infections is appropriate, as would be the use of decongestants and the avoidance of any activities that would exacerbate orbital emphysema. Which of the following statements regarding high-dose methylprednisolone after spinal cord injury is true? A. Dexamethasone is superior to methylprednisolone if a concurrent closed head injury is present. B. High-dose methylprednisolone should not be used to treat spinal cord injury. C. It is efficacious after penetrating injury if given within 4 hours. D. It is efficacious in cases of spinal shock. E. It is more efficacious after thoracic than after lumbar injuries. Answer is B. High-dose methylprednisolone should not be used to treat spinal cord injury. Evidence that high-dose methylprednisolone is a clinically efficacious intervention in the management of acute, blunt, partial spinal cord injury is lacking and, because of severe side effects, should not be used. A 27-year-old man presents after a high-speed rollover MVC. The physical examination is remarkable for T8 motor sensory deficit and a moderately distended abdomen that is non-tender. Vital signs are heart rate, 108 beats min, blood pressure, 88/40ths of a millimeter Hg, respiratory rate, 22 breaths min, temperature, 35 degrees C, 95 degrees Fahrenheit, and oxygen, O2 saturation, 96%. Which of the following tests or treatments is indicated? A. Baseline laboratory tests and observation. B. Computed tomography, CT, scan of the abdomen. C. Intravenous phenylephrine infusion. D. Packed red blood cell transfusion. E. Thoracolumbar spine films. Answer is B. Computed tomography, CT, scan of the abdomen. Spinal cord injury often renders the abdominal examination unremarkable. CT, ultrasonography, diagnostic peritoneal lavage, or some combination is necessary to rule out intra-abdominal injury. The presence of which of the following signs after penetrating neck trauma would indicate a likely benefit from surgical intervention? A. Decreased or absent radial pulse. B. Small degree of hemoptysis. C. Horner syndrome. D. Muffled voice. E. Stable hematoma. Answer is A. Decreased or absent radial pulse. Hard signs of penetrating neck trauma are the presence of an expanding hematoma, severe active bleeding, shock not responding to fluids, decreased absent radial pulse, vascular bruit thrill, cerebral ischemia, and airway obstruction. Most patients with hard signs benefit from surgical intervention. Which of the following statements regarding airway management after penetrating neck trauma is true? A. Awake fiber optic intubation is the first-line technique. B. Bag valve mask ventilation should be high tidal volume, low rate. C. Cervical spine immobilization is typically unnecessary. D. Nasotracheal intubation position is relatively contraindicated in neck trauma. E. Pre-intubation nasogastric tube placement may be life-saving. Answer is C. Cervical spine immobilization is typically unnecessary. Unless there is concomitant blunt injury or evidence of spinal cord injury, cervical immobilization is not needed. Classic oral intubation after rapid sequence intubation, RSI, is the technique of choice and is successful in almost all cases. Although rarely a first-line choice, nasotracheal intubation has been used successfully in these trauma patients. Gentle bag valve mask technique with low pressures is indicated to avoid venous air embolism, VAE, and subcutaneous emphysema. NGT placement, if done at all, should be gentle and placed after intubation.